Oh boy. Hello. How are you guys doing? Yeah, good day, good day, good day, everybody. We are 35 people here. Let's give them 4 minutes. Hello. So at the end of this session, for people that are in my class, please 5 minutes to the end of the class, tell me. I'm going to give you a link for you to put in the attendance for me. For people that are in my class. Thank you for asking. Thank you for asking. My leg, I don't know. Honestly, I really don't know. The leg is not legging. The leg is I don't know what is wrong with it. I don't know what is wrong with it. It's just messing up. Sorry, this my laptop lags behind a little. All right, so you bear with me. I already put order for a new one. So 70863. 70K subs. You guys are very few now. I don't know if it's possible. He said, let's get into 70K subs. Thank you. I love that. Please, if you've not subscribed, subscribe, all right? Because I'll be taking some pathology and microbiology courses. So, and pharmacology as well later on. So you'll be notified, Quick question. For the Wednesday, will it be 50 questions because it's 15? Yeah, possibly. No, it will be around 60, between 60 to 75 questions, but it will be like 50 minutes. That's why the review tomorrow is extremely important, all right, for people that are interested. So like yesterday, I did review yesterday, but you guys were very few. But it doesn't matter. When you come, you can just go on my link to look at the review, all right? For yesterday, it was just endocrinology. You get it? So, but tomorrow it will be both male and female reproduction. So you cannot fail to miss it. Fail to be in that class. Okay, I think this is 2:35, so I'm going to start now. Before we start, I want you to bear some things in mind, all right? Is he lagging for you guys? Yes, I'm lagging. It's not your fault. It's my computer, all right? This computer is terrible. I've been managing it, but I wanted to buy. Okay, I bought a new one today, or I paid for a new one today, but it's not here yet. I thought it would be cheaper, but it wasn't cheaper. But they gave me a discount, professor's discount. Okay, so we are up to 60 people here. That's a good number. But please, anybody that is not here, better tell the person to try and join in. Hold on. Okay, sorry. Now, I want you guys to listen to this question. Before we start this discourse, I want to give you 6 questions. Hold on, I'm trying to select. the questions. Okay, so listen to this. This was your exam last year, all right? I just want you to listen to it so that when we are doing this discourse, you understand how important these things are, all right? Pay attention. Which of the following descriptions best matches the term myometrium? You are expected to know what myometrium is, because if you don't know what it is, you will not know what matches the term. Like they said, consists of functional zone and basilar zone, supports the uterus laterally, supports the uterus anteriorly. After ovulation, the ovum is captured by it, thick layer of the smooth muscle cells. These are the options. Now, another question is asking, one of the following is not a female sexual phase. So when you are having sex as a female, which one is not a phase of that sexual activity you're having? You understand the points? So that's what they are asking here. The options are just there. Don't worry, we'll discuss it. The dash are finger-like projections that capture the freshly ovulated ovum. Infundibulum, uterine tunnel, uterine horn, gubernaculum, fimbria. The dash is the inner lining of the uterus. Is it the perimetrium? Is it the myometrium? Is it the exometrium? Is it the endometrium? Is it the epimetrium? The uterine phase that develops because of a fall in progesterone level is the dash. The uterine phase. Remember, we have uterine phase. We have ovarian phase. All right? No, I cannot send the question. Sorry. I cannot send the question. I don't even know if I'm allowed to discuss this thing with you, but it's okay. Anything for you guys. You don't need the question. What you need is to just listen and understand. You understand? Listen from beginning to ending. See, now we are 45 from 70 back to 45. Meaning that some people just come check. Is he taking attendance? No, they run away. I'll take attendance, but I know when I'll give you the link. Not now. And it will just last for like 5 minutes. Okay. The principal hormone secreted by the corpus luteum is what? Is it the progesterone? Is it the FSH? Is it the estrogen? Is it the LH? The granulosa cells of the developing follicle secrete what? The primary follicle develops from the dash. Which of the following is not a similarity between the testis and the ovary? And others. Like, I had to mark these questions. All right. So let's go to our discourse today. I'm going to share my screen, guys. Please, it might be lagging behind, but if it's lagging too much, tell me so that I'll slow down, because most times I talk very fast. You understand? So let me share my screen now. Yes, the life will stay up. Yes, I'll try not to go very fast. All right, I will just take it tonight. It will lag more. Yeah. Please, if you can see my screen now, just type yes. Yes, I will do exam review YouTube live tomorrow. I'll give you the time. Yeah, some people complain that I give the time late. Yes, that's when I'm home. I don't want to disappoint. I don't want to tell you, oh, I'm going to have a class by 7 p.m. and by 7, I am not there. So it's better for me to make sure, okay, maybe I am in my house already, right? Then I'll answer, okay, in the next 1 hour, we're going on live, or in the next 2 hours, we're going on live, all right? Okay, perfect, guys, perfect. I'm suffering with this laptop, honestly. I don't know why it's slow. Maybe there's a lot of things in it. Okay. The number has increased to 79. If we can maintain this number till the end of this discourse, I won't even bother taking attendance. I won't bother submitting anything to the department. For real. I'll just write it, everybody absent. But my problem is when this number decreases to 40, nah. Okay, guys, so let's proceed. The difference between the male reproductive system and the female reproductive system is that the female reproductive system is actually more complex, all right? Why? Because it's involved in not just sex, all right? Not just in urination or whatever, like the male, but this one is involved in producing and delivering gametes, receiving gametes, like receiving sperm, producing nutrition to harbor the baby, the fertile life. It gives birth, it nourishes the infants. So women are extremely important, honestly, to our society. All right. So these are the important things why a female reproductive system is actually more complex. We are a lot of things we're going to learn today, but I'll be very fast because our time is limited. This is just a 2 hours discourse. So I'll be very, very fast. Last time we discussed things about the male reproductive system. All right. And I will change this slide quickly. This is male reproductive system that we discussed last week. All right. Bear with me for a minute. Let me see. I hope I'm not lagging. Okay. Perfect. Nobody has complained. So last time I complained to you, I discussed with you that for the male reproductive stuff, right? It's as a result of when the X and the Y comes together, it becomes male. X from the mother, Y from the father. It becomes what? Male. That's XY. All right? Good. Now, we also discussed last time. Hold on, I'm trying to review exactly what we discussed last time. Okay, the gametes. Yeah. There's something I'm trying to mention so that you guys will understand it, exactly what I'm talking about. Okay. Now, last time I also discussed about the SRY gene. All right, SRY gene. I told you that SRY gene, right, is the sex determining gene in the region of chromosome Y. How do you develop male features and how do you develop female features? For male, immediately there's Y chromosome. On that Y chromosome, there's SRY gene. That SRY gene, right, it codes for a protein. That protein, we call it what? TDF. TDF is testis determining factor. You understand? This TDF develops the testis. This is the male, right? It develops the testis. And once it develops the testis starts producing testosterone. Now, this testosterone causes what we call what? Stimulation of the mesonephric duct. Now, there are two ducts, as I discussed last time. We have the mesonephric duct and we have the paramesonephric duct. The mesonephric duct is what develops into female genitalias, all right? That's paramesonephric duct. That the mesonephric duct develops into male. Now, for that mesonephric duct, you understand, to remain, it needs testosterone. So testosterone stimulates mesonephric duct to develop. At the same time, it has to degenerate the paramesonephric duct. So what does the testis do? The testis produces what we call what? MIF. That's Mullerian inhibitory factor. MIF. MIF. All right. So what I need you guys to know, that's why I'm taking it back, is that for male to be male, like I keep telling you that the default setting is female. So for the person to be a male, that means there's Y chromosome, and that Y chromosome needs to have SRY gene. That SRY gene need to produce what? TDF. That TDF need to develop the testis. The testis need to develop two things. One is testosterone. Two is MIF, Mullerian inhibitory factor. They will ask you in the exam. The testosterone, the function is that the testosterone helps to maintain mesonephric duct. Why the MIF, the Mullerian inhibitory duct, we degenerate the female duct, which is the paramesonephric duct. If you understand it to this level, then we are good to go. Another thing you need to understand is that it is not the female hormone that makes a woman a female a female. No, that's the point I'm trying to make. Not the female hormone. All right. Instead, it is the absence of that male hormone that makes somebody a female. Yes, I know I'm lagging, but if you can hear me, good and fine. Sorry. Now, this is sexual differentiation. Without testosterone, right, this is what happens. Without MIF, this is what happens. So if there's no MIF and no testosterone, the paramesonephric duct will remain, and the mesonephric duct will do what? Degenerate. I hope you guys understand it to that level. I'm really speaking very slow because I don't want to lag too much. All right. Now, they will ask you about the internal and the external genitalia of a female. Internal genitalia, we have the ovaries, we have the uterine tubes, we have the uterus, we have the vagina. We have the labio minora, we have the labio majora. You have to remember this because they will ask you which one is the external genitalia, which one is internal genitalia. Also, you need to know what the primary sex organ is. For female, it is what? Ovary. For male, it is testis. All right. Now, the secondary sex organ is all these genitalia, both internal and external genitalia, apart from ovary. That's what we call secondary sex organs. They will ask you, one of the following is primary, one of the following is what? Secondary. You see this diagram? You should appreciate this diagram. Extremely important. This thing, this one that is lying down here is the uterus. All right. If you can see my arrow, I'm pointing it slowly so that it will not lag. This is the uterus. From the uterus, you see the cervix. From the cervix, you come down and you see the what? The vagina. All right. Then behind it is the what? The anus. This is the anus behind it here. This is the vagina. This is the recto-uterine pouch, where we usually check for infection if there is a fluid there. All right. But this is not pathology, so I'm not going to spend much time on this. I need you guys to look at this very well so that you understand. In case of they give you a picture in your exam, you'll be able to know what they're talking about. Let's talk about the ovaries. All right. The ovaries is the female gonad that houses the ova, which is the egg. It produces also sex hormones. The outer covering is the tunica albuginea, which is the same outer covering that covers what? The testis. Very, very important to know. Egg develops inside it. All right. Inside the ovary, you will see groups of eggs, which we call what? Follicle. Groups of, follicle, group, inside one pouch. We'll discuss that later. When these follicles burst, right, it releases what? Eggs. All right. So there's follicle. There's a lot of follicle inside one ovary. Each follicle contains around 24 eggs. Now, one of them mature. Among those 24, one of them mature. Then the entire follicle bursts. All the other 23 eggs wasted. Only that one is useful. We'll discuss that later. And that bursting and release is called what? Ovulation. You need to know what ovulation is, in case of if you're asked. There are attachments, things that holds. You need to know things that holds the ovary. This thing is not making me talk the way I want to talk. You know me normally now. I'm always vibrant and vibrating. So there are things that holds the ovary that you need to know. You need to know the ovarian ligament. You need to know the suspensory ligament. These are the most important. You need to know also the broad ligaments. Very, very important. One of the most important is the suspensory ligaments. How do you identify suspensory ligaments? You will see the veins and the artery inside it. Immediately you see the veins and artery inside it, you know that this is definitely what? Suspensory ligaments. Then I would show you the ovarian ligament as well. All right. All of them are holding on to the ovary so that the ovary does not fall off. Now, there is also blood supply, which we will discuss. But the major two blood supplies to the ovary is what? The ovarian artery and what? The ovarian branch of the uterine artery. So the uterine artery actually supplies the ovary. But which branch? The ovarian branch of that uterine artery. And also the ovarian artery. All right. You need to remember this. And this ovarian artery is equivalent to what? The testicular artery in male. Then we also have lymphatics. Extremely important that you know it. This is the beautiful structure of the ovary. All right. This is the beautiful structure of the ovary. So anybody that, if you have ovary, this is how it looks. All right. Now, these are the primary follicles. Somebody said, hi, Professor. Welcome. Yeah. So these are the primary follicles, the primordial follicles, the little ones here. They develop into what? The primary follicle, from there to the secondary follicle, to tertiary follicle, to the mature what? Follicle. Inside this mature follicle, you will see the oocytes. All right. Then at the end of the day, it bursts. You follow the arrow, it bursts here. This bursting is ovulation. And when there's ovulation, the remaining contents of this follicle will become what? Corpus luteum. The corpus luteum then start degenerating and wilting towards corpus albicans. Okay, it's not lagging for you. Oh, okay, perfect. It's lagging. Yes, I know I'm lagging a little, but okay, I'm speaking slowly so that I won't lag. Okay, so if you look at the artery, you see this is the artery and the vein and the nerves. You see how it enters this guy. Automatically, you know that this guy is what? Suspensory ligament. This is the kind of question that we ask you. And this is ovarian ligament here. Okay. Now, let's talk about the tubes. We have the uterine tube. Another name for the uterine tube is oviduct. Another name for the oviduct is what? Fallopian tube. See my hand? This is how it is. Let me make it ahead. This is how it is. This is the fine. Then this long thing here is the uterine what? Tube. Extremely important that you know it. It is ciliated. It has cilia because the egg, the fibria, picks the mature follicle into it, takes it inside. Then the mature follicle start crawling in the uterine tube. What is pushing it forward is the what? The cilia. That's why it is a ciliated muscular tube. Extremely important that you know it. So this is exactly what I was trying to describe. You see it? This is the fibria. Picks the mature follicle and start transporting it straight into the uterus. You see it? Now, the oviduct or the fallopian tube contains what? The infundibulum, the ampulla, and what? The isthmus. These are the three parts. You must know these three parts. You must know these three parts, guys. Okay? So let's make progress gradually. So this is exactly what I just described. This is the infundibulum, this is the fibula, this is ampulla. Okay, it has the isthmus, just the narrow area. Let me see if it's in this diagram. Yeah, this is isthmus here. So it has the infundibulum, the ampulla. This is the isthmus here, just this narrow area. All right. Okay. I hope I'm not lagging. I'm trying to be so slow. I hope I finish on time today, guys. So now let's talk about the uterus. Remember, we've discussed what the oviduct or the fallopian tube. Let's talk about the uterus. The uterus is pear-shaped, right? It harbors the fetus. It provides source of nutrition. It expels the fetus also, all right? And it is usually in front, anteriorly, a little anteriorly to the urinary bladder. That's why when a woman is pregnant, sometimes it compresses the urinary bladder, all right? Now, the uterus is pear-shaped. It has three parts: the fundus, the body, and the cervix. The fundus, the body, and what? The cervix. This is the diagram. You see? Look at the fundus here. This is the fundus. Then this everywhere here is the body. And this small hole here is what? The cervix. Extremely important that you know this. All right? Okay. Now, the cervical canal, along that cervical canal, you now have internal os and the external os. Internal os is superior opening of the cervical of the canal into the body of the uterus, while the external os is the one that goes to the vagina. Look at what we are talking about here. So if you look at it here, this is the cervical canal, all right? This part that is upwards facing the uterus is what? This part that is going outside, this is vagina. Remember, this is vagina. This part that is going outside towards the vagina is what? The external what? Os. It's going outside, so it's external. It makes common sense. You need to understand it. All right? It makes common sense. And another thing I need to show you, if you look at this very, very well, you see this ligament that has the ovary, that has the ovarian artery and ovarian vein. That's the suspensory ligaments. You see, this one that is big here is the broad ligament. Extremely important. This is the uterosacral ligament. We'll discuss it later. This is the round ligament, and this is mesometrium. All right. Okay. Why do we do pap smear? We do pap smear to be able to, check for cancer. All right. We want to catch it on time because it can have different grades. The cervical cancer, we call it cervical intraepithelial what? Neoplasia. Anything neoplasia is what? Cancer. It has type 1, type 2, type 3, or class 1, class 2, class 3. Class 1 is the just mild dysplasia, all right? It's just beginning to change. Type 2, you understand? That one, we do biopsy for it. Very, very important because it is not a full-blown cancer. Why type 3 is the one that, starts moving out, all right? So each of the types will, the type will determine how we take care of it. You understand? The type will determine how we take care of it. But it's always very important to do the pap smear so that we'll be able to discover it on time because it's very, very prominent in females. All right? Obviously, male don't have cervix, so we don't have it. Okay. Now let's talk about the wall of the uterus. The wall of the uterus. We have the perimetrium. We have the myometrium. Remember the myometrium? I asked the question on the myometrium. The question I saw on your myometrium, they say, which of the following descriptions best matches the term myometrium? That's why it's important. So this is perimetrium, is just the external serosa, right? The myometrium is a middle muscular layer, all right? Very muscular. Constitutes most of the uterine wall, composed mainly of what? Smooth muscle. Smooth muscle. It is this myometrium that leads to what? Labor contraction. And the point is that when this myometrium is found outside the uterus, we call it what? The endometriosis. We'll discuss that later. You understand? This contraction is what causes those serious pains, but we'll discuss it. So this is endometrium as well, all right? This endometrium, that's inner mucosa. Inner mucosa. It has the functional layer and the basilar layer. If you look at what this place says, the first option says, it's talking about myometrium. The first option says, consists of the functional zone and the basilar zone. This first option is describing the endometrium. Sorry, what I said initially was wrong. The endometrium is when it's found outside the uterus. That's what causes endometriosis, not the myometrium. Okay, just a correction. So this is the functional layer and this is basilar layer of the endometrium. All right? But this is myometrium. Myometrium is the smooth muscle, very muscular. All right? While this is the endometrium. The endometrium, it contains the functional layer and the basilar layer. The part that sheds when you are having your period, menstrual cycle, is called what? The functional layer. It's the part that sheds. They will ask you this question. The part that stays behind is the what? The basilar layer. I'm taking my time to stress on this. The part that sheds when you are seeing your period is what? The functional layer. The part that remains to rebuild, to regenerate is called what? The basilar layer. During pregnancy, the endometrium is what? The site of what? Attachment of the embryo. And this is also where forms what? The maternal part of the placenta that helps to nourish the baby. So you need to know the function of the endometrium, the difference between the endometrium and what? The myometrium. I am stressing on it. Very, very important. All right? Okay. Let's talk about the ligaments so that you understand the ligaments very well. The ligament supports... Okay, look at this question. The same question. Which of the following description best matches the term myometrium? The first option says, consists of a functional zone and a basilar layer. We know this is not myometrium, this is endometrium, so that's out. The second option says, supports the uterus laterally, supports the uterus anteriorly. Now look at these ligaments. Look at the ligaments. What do we notice? There are different ligaments. The first one is broad ligament. It has two parts, the mesosalpinx, the mesometrium. All right? They are on the sides, different sides of the what? The uterus. Now look at the second one, is cardinal ligament. We call it lateral ligament. What does it do? It supports the cervix. It supports the cervix, both laterally and superiorly, extending to the pelvic wall. Then look at the uterosacral ligament. It attaches to the posterior side of the uterus to support the cervix posteriorly. Look at the round ligament. Arises from the anterior surface of the uterus. So it supports it anteriorly. So it means that this option that they say supports uterus laterally is already talking about the lateral cervical ligament, which is the cardinal ligament. So it's out. This one says supports the uterus anteriorly. Anteriorly is the round ligament. That's what supports the uterus anteriorly. So it's out. I don't know if you understand. So that's why you need to pay attention to this discourse so that you'll be able to get the right answer. All right? Okay. So this is the diagram. I don't want to waste time on it because we have a lot of slides to go. Now this is the blood supply. Blood supply, you need to know the uterine artery. Where does it arise from? Internal iliac artery. Check it out. From there, it gives rise to the arcuate artery, the spiral artery. All those ones is the ones you need to know later. All right. So the most important thing you need to know is that the uterine artery, this is the uterine artery. Where does it come from? It comes from the internal iliac artery. This is internal iliac artery. This is the uterine artery. All right. The internal iliac artery also gives rise to what? The vagina artery. So both the artery that goes to the vagina, this is it, and the artery that goes to the uterus is from the internal iliac artery. You see it? Now this uterine artery gives rise to what? Gives rise to these spiral arteries that are anastomosed and also this arcuate artery. Very important that you know that. Is there another review tomorrow? Yeah, this is not a review. I'm actually teaching the female reproductive system. This is not a review. The review is tomorrow. Now, let's talk about the vagina. All right? I don't want to stress on it. But the vagina is 8 to 10 cm distensible muscular tube, allows for discharge of menstrual fluid. It receives the penis. That's what the secretary that receives the penis is the vagina. And also it receives the semen. And that's where the birth of the baby comes from. All right? It has the adventitia, the middle muscularis layer, and the inner mucosal layer. All right. It has glands in the vagina. They will tell you one of the following is true of the vagina: no gland. So those vaginal fluid that you see is usually sweat, vagina sweating. This will be very funny, but someone is laughing. This is actually vagina sweating. All right. So serous fluid through its walls and by mucous fluid from the cervical gland above it. So there is cervical gland above, all right, and there is what, serous fluid from the walls. So this is just sweating. Transduction lubricates vagina. All right. Okay. I hope I've stressed on that. It also has furnaces and other things that you need to look up later. This is epithelium of the vagina. This is where it's important. There's something we call metaplasia. Metaplasia is what? The change of a particular epithelium to what? To another epithelium. The change of epithelium to what? Another what? Epithelium. That's metaplasia. It can happen in a lot of places. For example, there's pathological metaplasia, but this is what? Physiological metaplasia. Pathological metaplasia is people that are smoking. The epithelium of your respiratory tract is usually what? Pseudostratified epithelium. Now, when you smoke consistently, that pseudostratified epithelium changes what? To what? To stratified squamous epithelium, non-keratinized, which becomes a problem. That's why the person starts coughing a lot and all those things. That's pathology. But now, physiologically, because what we are discussing is physiology. Physiology is what? Function. All right? Physiologically, the vagina, the normal epithelium when the child is born, from birth to childhood, is what? Simple cuboidal epithelium. Now, estrogen now changes this simple cuboidal epithelium to what? Stratified squamous epithelium. Why? Because stratified squamous is what? Stronger. Remember, if it is just simple squamous epithelium, simple cuboidal epithelium, rather, if the penis enters inside, the penis will tear it up. Because the penis is strong, it will tear it up. All right? But the body has to, prepare itself for receiving of what? Penis. By what? Changing its epithelium to what? Stratified squamous epithelium. So that when the penis go in and out, right, it will not tear the entire thing. All right? So I need you guys to remember this thing. And another thing is that epithelium helps it to what? To anchor bacteria. These bacteria, they ferment glycogen and changes the pH in the vagina. This pH change inhibits what? Pathogens. That's why, not too long ago, somebody in Nigeria was telling me, oh, I'm having a vaginal this, that. I said, go do test for BV. She did test for BV, and she was BV positive, right? It's not a sexual infection, but usually BV occurs multiple sexual partners. Why? Because when they have multiple sexual partners, all right, those activities disrupts the normal architecture of the vagina, all right, and because of that, the pH changes. That pH change will allow these pathogens to grow. All right, so that's just, I don't want to stress on it more. Also, it has antigen presenting dendritic cells in the vagina. That's why somebody that has HIV sleeps with somebody. Sleeps with a male that has HIV sleeps with a female, her chances of catching that HIV is very high. Just from the seminal fluid, it's very, very high. Much more than a female that has HIV sleeping with a male that doesn't. I hope you understand what I'm talking about. Somebody said something. You see. Yes. Also, yes, those condoms also has fluids that disrupts the vaginal architecture. All right. But I don't want to talk about it. I really don't want to talk evil. All right. Let's be Christian. Let's be holy. Okay. I'm getting to the evil part. Now, this is the external genitalia of female. We have the mons pubis, we have the labia majora, we have the labia minora. All right. Labia majora, mons pubis, labia minora. The pudendal cleft. Extremely important that you know this. We also have the clitoris. The clitoris is very important because it's the erectile and the sensory organ. All right. That's the place that's very, very sensitive. All right. The clitoris has the glands, the body, the crura. We'll look at it now. And we have the vestibular bulb, which is the bracket of the vagina. All right. Okay. So this is a very good diagram. Or should I give this particular diagram? This one is better. So this is the pubic symphysis. You see the pubic symphysis? All right. Now, if you look at it down, this is the clitoris. This is the female vagina. This is the anus. This is the clitoris. You see? The first part of the clitoris is the glans. That is the most sensitive part. That's up part. All right. Then beside it, you see the crura. The crura is in both sides. all right, flapping out. Extremely important that you know this. Now, if you look inside very, very well, see, there's one tiny hole inside. That tiny hole is what? The urethral orifice. That's where urine comes out from. This particular tiny hole, the urethral orifice. But this is the vaginal hole. This is urethral orifice. This is vaginal hole. Then there are glands here that's called the para-urethral gland. They are around the urethral orifice, not the vaginal orifice. That's why we say there's no gland in the vagina. All right? Aha. Then what else should I show you? I think that's it. That's the external genitalia. All right. So you need to look at this diagram, snap it, use it to do your wallpaper. All right. Extremely important. Now, other areas in the female anatomy talk about the breast. It's just amount of tissue overlying the pectoralis major. This is pectoralis major. All right. This tissue is on it is the breast. Male has breast also, but the women, their breast is also enlarged, especially during puberty, and it remains like that till the rest of their life. Understand? It contains very little mammary gland, but a lot of mammary gland develops during pregnancy and remains active in lactating breast. And when you stop lactating, it atrophies. Please remember that. All right. So they may ask you a question on this. They may tell you which one is true. Mammary gland develops when the breast in the breast during what? Pregnancy. Remains active in lactating breast and also atrophies when you stop lactating. Bear that in mind. All right. For the breast, we have the body and we have the axillary tail. All right. That's part that enters through the armpits. That's especially where we see where the lymphatics. Extremely important that you know this. Then we know also the nipple has capillaries, sensory nerve fibers. That's why it is very, very sensitive in women. All right. It triggers women a lot. And not triggering them in only sexual activity, it also triggers them in terms of what? Ejaculation of what? Milk. That's why if a woman is not producing milk, a newly lactating mother will just take the baby and put, so that the baby will just put mouth in the nipple. All right? Aha. Okay. So around the nipple, we also have areolar glands. We have smooth muscle. Look it up later. Most non-lactating breast is usually fats, dominant of what? Adipose tissue. All right. Then it has the subsensory ligament that attach breast to the skin. Also, you need to know this. Now, they may ask you how many lobes around the nipple. 15 to 20 lobes. Also, the lactiferal duct, which drains each lobe. So 15 to 20 lobes ends into the lactiferous duct. All right. Lactiferal duct opens opens into the lactiferous sinus. The sinus is the one that opens out into the nipple. Extremely important that you know this. This is the diagram that we're talking about. This is the diagram. You see the ducts? These are the ducts. These are the ducts. This thing that's on, I don't know if this is pink. This is what? The lobule. All right? This is the lobus or the lobes. From there, you see the lactiferal duct. You see this swollen thing here? These are the sinus. The sinus now comes out through the nipple. All right? Then this is the areola. This is the areolar glands. Extremely important that you know this very, very well. All right? Okay. So let me proceed. I think we are moving. How many minutes have we spent? That's 8 minutes, and we are in slide. Okay, this is good. We are working. Please, if you have any question, just drop it. I will answer your question. Please drop it. Breast cancer is very common among women. One in out of 8 to 9 American women, has breast cancer, and it's a leading cause of female mortality. It kills a lot of women. Then in College of Medicine, my professor, then the wife died of breast cancer. All right, and a lot of people, has died of breast cancer. It's one of the leading causes of female mortality. So you need to put this in your head. Same thing with the cervical cancer as well. All right, that's why you have to always do tests at least once a year. Like for breast cancer, you do the mammogram once a year to know, especially if there's somebody in your family that has it. Very, very important you know this. All right. These are the signs of breast cancer. All right. Lumping, skin puckering, changes in the texture, and drainage from the nipple. All right. And the drainage from the nipple, there are colors. Some are green, some are reddish. All right. We have to differentiate it from prolactinemia, where the breast milk comes out. You understand? So this is breast cancer, but anything that is coming out from your breast, please go to the hospital and check it out. Extremely important that you do this. These are the contributing factors to breast cancer. We have the BRCA1 and BRCA2 gene. All right. I'm not talking about it. BRCA1 and BRCA2 gene. Risk factors: age, radiation, carcinogenic chemicals, excessive alcohol intake, and fat intake, and also smoking. Smoking, most especially, is one of the highest risk towards breast cancer. So we need to know this and be aware. All right. So this is mammogram. I mentioned it initially. For you to, you need to be doing this thing at least yearly. Now, this is treatment for breast cancer. We have lumpectomy, we have simple mastectomy, we have radical mastectomy. I'm not going to discuss much on this, all right? But these are the ways we remove what? Tissues. We remove tissues. For example, the simple mastectomy, we remove what? Removal of breast tissue only, or breast tissue and some axillary lymph nodes. Only the breast tissue or the axillary lymph node. But when you are talking about radical mastectomy, you are removing everything, both the underlying fascia, both the lymph nodes, everything. You are removing it. That's radical mastectomy. But simple mastectomy, you are very specific. But lumpectomy, you are just removing that lump. All right. Then after doing this, you need to do what? Radiation or chemotherapy. You choose which one works best for you and your patients. All right. Then sometimes the plastic surgeons can do reconstruction of that particular breast. So if you look at it, this breast was removed completely. This mastectomy, complete removal. All right. Okay. So let's go to the more important things that are going to come out for your exams. Let's talk about the puberty. Puberty usually begins at age to 10, 8 to 10 years for most girls in the United States, triggered by rising of what? GnRH, gonadotropic releasing hormone, which stimulates what? Anterior pituitary. Remember I told you, releasing hormones are from where? The hypothalamus. Extremely important that you know this. Releasing hormones are from the hypothalamus. As a recap, the hypothalamus produces what? 8 hormones. 6 produces 8 hormones. 6 hormones goes to the anterior pituitary to encourage the anterior pituitary to what? Release its what? Stimulating hormones or inhibiting hormones. Extremely important that you know this. 2 goes to the posterior pituitary. That's the ADH and what? And the oxytocin produced in the paraventricular and supraoptic nuclei. You need to know where they are produced, especially those 2 at the back, at the posterior pituitary. Very, very important. Just a recap. Now, GnRH is one of those hormones produced by the hypothalamus and goes to the anterior pituitary. In the anterior pituitary, it encourages it to secrete what? Follicle-stimulating hormone and luteinizing hormone, which goes to the gonads. FSH stimulates what? Ovarian follicles, and they begin to what? Secrete what? Estrogen. So what secretes estrogen? Ovarian follicles. What secretes FSH? Pituitary. So pituitary stimulates, secretes FSH. FSH goes to the ovary, encourages the ovarian follicle to start producing what? Estrogen, progesterone, inhibin, and androgens. Very, very important that you remember this. When you're talking about the estrogen, is the major feminizing hormone. This is the estrogen that makes people start, developing all these feminine features. All right. The most common estrogen is what? Estradiol. We have estradiol, we have estriol, we have estrone. But the most common is what? Estradiol. That's what the one they will ask you in your exam. Estradiol is the most common estrogen. You can't fail this. Now, talking about the stages of puberty, we have the telac, we have the pubac, we have the menac. The 3 of them. You need to know the differences between the 3 of them. For the telac, it is when the breast start developing. Usually when the breast start developing, noticeable sign of puberty. All right. What leads to telac? We have what? Estrogen, we have the progesterone, we have the what? Prolactin. All of them triggers everything, and the breast starts getting bigger. All right. Adipose starts mounting on the P major. All right. Now that's telac. Now for pubac, what happens in pubac? Pubic hair. Pubic hair. Remember it that way. So pubac, we have the appearance of what? The pubic and what? Axillary hair, sebaceous gland, and axillary glands. You see every hair start developing everywhere. This pubac is usually controlled by what? Androgens from the ovaries. Androgens. You understand? So all these things stimulate pubac, and at that moment, the lady starts feeling sexual. All right? Telac, pubac. Telac, pubac. Please remember this. Extremely important. Okay. Then we have the menac. This menac is very, very important. What triggers the menac is something we call leptin. Remember leptin. Leptin is, the hormone that makes you thin. Leptin makes you thin. Leptin makes you thin. All right? Ghrelin makes you fat. So leptin is what usually stops them from, stops people from eating food. You feel very filled, That's why they will not eat food, and because of that, they start getting what? Slim. Yes. Okay. Now we're talking about menarche. You need to know which hormone controls which stage. Just don't know the stage. All right. And in menarche, that's where the first menstrual period starts. Leptin stimulates what? Gonadotropin secretion. All right. Now, it works with the body fat. If the female's body fat is too low, if the female's body fat is too low, this menstruation will not occur. All right. The person will be at menarche, but that menstruation will not occur. Very, very important that you know this. So menstruation ceases when body fat drops below what? 22% in adult women. So they need that natural body fat for them to what? Start stimulating, start giving out what? Menstruation. Extremely important that you know this. So just know the three of them, the telag, the pubic, and what? The menarche. Know what happens in each of them, so that when they ask you, so and so thing happens, where does it happen? You'll be able to know, get exactly where it happens. I told you about estradiol. Extremely important. This is what causes puberty. Extremely important. It leads to vaginal metaplasia. It stimulates growth of ovaries. Stimulates growth hormones. The girl starts getting wider hips, getting taller very fast. All right. The breast start getting bigger very fast. You understand? The glutes start getting big also. But most times, the girl still remains thinner and softer, unlike the men. All right. So the fat deposition is very structured, very, very, very structured. You should remember this. All these things happens as a result of what? Estradiol. So we should go and thank what? Estradiol. Better go and thank estradiol. Okay. Progesterone primarily acts on the uterus, prepares it for what? Pregnancy. In the second half of the menstrual cycle, we'll discuss that. So the two major hormones, progesterone, estradiol. Progesterone, estradiol. We also have inhibin. Inhibin suppresses FSH when they want FSH to stop coming. All right. Estrogen and progesterone also suppresses what? FSH and LH. This is what we call negative feedback. Remember, I discussed negative feedback yesterday in hormones. So when the FSH is too much, it's too much on the gonads, the ovary will be like, you know what? I'm done with this FSH. It's too much. Please let it stop. What does it do? It will go and tell the hypothalamus. Hypothalamus, stop producing what? GnRH. Because it is because you are producing GnRH. That is why what? The pituitary is producing what? FS and LH. That's one way of making negative feedback. Another way is that it will be like, you know what? Estrogen, the ovary will be like, estrogen and progesterone, please go and forget about the hypothalamus. Just go straight to the pituitary. Tell the pituitary, even if the hypothalamus is releasing a GnRH and telling you to keep producing FS and LH, don't do that. That is also what we call what? Negative feedback. All right? Or it can produce what? Inhibin. Inhibin will just suppress FSH. So it depends on what he wants to do. You understand? So there's multiple ways, 3 different ways it can cause what? Negative feedback or suppression of too much production of FSH. All right? Now, there's something called climacteric. This midlife change in hormone secretion. This is exactly before what? Menopause. Menopause is cessation of menstruation. Usually, women are born with more than 2 million eggs. All right? Climacteric period begins when there are about 1,000 what? Follicles left. Most of them degenerate, break down. There's 1,000 follicles left. All right? And before you know it, the follicles start what? Responding to the estrogen and progesterone and start getting mature one after the other. Every month, one follicle has matured. Every month, one follicle has matured. And each follicle contains what? 24 ovaries. You understand? So that follicle are matured. There is one particular ova that is very, very mature there. You understand? Ovulation happens, all the 24 pours out, 23 destroyed, 1 is the one that comes out. And if it is fertilized, it becomes the baby, becomes the embryo. Sometimes there may be 2 that may mature in one particular follicle. That's how we have what? Twins. Sometimes it may be 1 that breaks into 2. That's how we have what? Identical twins, not fraternal. So you should remember this, all right? Also, at that climacteric period, a lot of things happen. The uterus, the vagina, the breast become atrophied, right? Intercourse becomes very uncomfortable. That's why very elderly women, intercourse is always very difficult for them. Vaginal infections become very common. Skin becomes what? Thinner. All right? Aha. Also, cholesterol level rises, bone mass declines, blood vessels constrict and dilate in response to shifting hormone balances. Extremely important. So most times what we usually do to the elderly women so that they can still enjoy sex is by putting them hormone replacement therapy. There are risks to it, but there are also benefits. Some women will say, you know what, I will still want to be having sex at 60 years. You know what, please give me hormone replacement therapy. You give them, and their body will start responding to it, and they will start feeling good about themselves and start enjoying sex again. No longer painful, no longer much atrophy. Sex starts becoming good. All right. Okay. Now let's go straight to the oogenesis and sexual cycle. Extremely important. You need to differentiate between the reproductive cycle and the sexual cycle. Reproductive cycle is what happens from fertilization to giving birth and to returning to fertility. That's reproductive cycle. Sexual cycle is what happens every month. And there are two types of sexual cycle. We have ovarian cycle and we have menstrual cycle. Ovarian cycle, what happens in ovary? Menstrual cycle, what happens in the all right? Ovarian cycle, ovary, menstrual cycle, usually the uterus happenings or events or doings. All right? So you need to remember this. So both ovarian cycle and menstrual cycle are in sexual cycle. So when they ask you a question, you need to be able to differentiate this. See how I'm taking my time? Okay. Okay. Oogenesis is egg production. All right? Egg production, we discussed spermatogenesis also the other time. Egg production. Now let's see how this thing happens. First of all, the embryology, 5 to 6 weeks, the gonadal ridge is colonized, all right, leading towards differentiation into oogonia, which multiplies in the 5th week to give 6 to 7 million number. Hold on, somebody said something. Other people's period stop because it's caused by declining hormone levels. Yes, usually estrogen, all right, and some atom of progesterone. We'll discuss that. Now, what the HRT, that hormone replacement therapy, is to give them that estrogen. You understand? And they start feeling good about themselves. All right, we'll discuss that. Don't worry. Okay, so there are about 6 to 7 million oogonia produced. All right. So somebody said something. Okay, thank you. Yeah. So now this oogonia, they transform into primary oocytes in early meiosis 1. Remember, in male reproduction, we discussed meiosis 1 and meiosis 2, right? In female, we're also discussing meiosis 1 and meiosis 2. Initially, there is oogonia. Oogonia. Now, those oogonia, they become primary oocytes in early meiosis 1. Now, most degenerates and become atretic, all right, by the time the girl is born. Now, by the time the person is born, from that 6 million, it can drop to like 1 million. All right. Now, it will now undergo different stages. By puberty, there is remaining only 200,000 oocytes that remains by puberty. And ovulation is usually around 480 times in lifetime. And the egg will finish. And once the egg finishes, that is menopause. Menopause. Menstruation. Pause. All right. Okay. So this discusses about the production of the egg, how the egg develops. First of all, FSH stimulates monthly cohorts of about 24 oocytes to develop to complete meiosis 1. That's what I mentioned initially. About 24 oocytes complete meiosis 1. Each oocyte divides into two haploid cells, daughter cells of unequal size. 2. Now, they become secondary oocytes. A large daughter cell that is product of meiosis 1. Now, something you need to know is that those 2 that are produced, one will degenerate. We call it the first polar body. First polar body. Now, secondary oocyte, large daughter cell that is the product of meiosis 1. All right. Now, this is the polar body that I was telling you about. I'll show you a diagram. Don't worry. Now, this secondary oocyte, that's second one that survives. After meiosis 1, 2 are produced. After meiosis 1, 2 are produced. The one degenerates. That one that degenerates is the polar body. Then that one that is remaining will now enter second meiosis. That's meiosis 2. Does it make sense? It's not second meiosis. Now, in that second meiosis, if you pass the prophase 2, then it will enter the metaphase 2. In that metaphase 2, it will stop. they will ask you a question in your exam. Where is the secondary oocyte arrested? It is arrested in where? Metaphase 2. And now, if you now ovulate, that the secondary oocyte that is arrested in metaphase is still in metaphase 2. It will come, if the sperm reacts with it, you understand, it will automatically proceed from metaphase 2 to anaphase 2, you understand, to telophase 2. That's what they are just trying to tell you. So it has to be arrested there until it is what? Fertilized. And immediately it is fertilized, you know, it has to give birth to 2. Meiosis 2 give birth to what? 2 oocytes, 2 secondary oocytes. One will degenerate again. So that one that degenerates again is called what? The second polar body. We don't want to give birth, bring 2. We just want 1. So the meiosis 1 will give rise to 2. 1 will degenerate. That's the first polar body. This meiosis 2 will also give rise to what? 2 during fertilization. 1 will degenerate. That one that degenerates is called the second polar body. They will ask you, where is first polar body formed and where is second polar body what? Formed. I hope I'm making sense. Okay. So this is what I was telling you here. If you look at this diagram, guys. This is meiosis 1. All right. Multiplication. Primary oocytes become primary oocytes. Primary oocytes, you know, once meiosis 1 is completed, primary oocyte has to give birth to 2. This is 1, and this tiny one is another second one. So this tiny one degenerates and become what? The first polar body. That's when meiosis 1 is complete. So we now have only 1 secondary oocyte. This secondary oocyte will continue. If it is not fertilized, it will break down, right? If it is fertilized, you understand, it will complete meiosis 2. That completion of meiosis 2 will give birth to 2 secondary oocytes. Now, one of that secondary oocyte is this tiny one. It will break down and become what? Second polar body. Second polar body. You need to know that the second polar body is not formed when the egg is not fertilized. If the egg is not fertilized, it will just break down. Nothing like polar body, second polar body needs. But if the egg is fertilized, immediately the second polar body is what? Formed. All right? Then the meiosis 2 is complete and it will proceed to what? Embryo. That's the zygote stage. Very, very important that you know this. Extremely important that you know this. All right? Okay. So this is everything we just discussed. We call it folliculogenesis. In folliculogenesis, it's talking about the sac, the bag. All right? Remember I told you, if this is ovary, the ovary has a lot of eggs in it, ova, right? Now, 24 eggs will come and call themselves and they will be in one group. Another 24 in one group, another 24 in one group, another 24 in one group, another 24 in one group. Each of those groups is called what? Follicles. They're primordial follicles. All right? Each of them generates, each of them starts the cycle of what? Getting mature. And that cycle takes what? 290 days. So every month, one starts its cycle. Every month, one starts its cycle. So if today you are ovulating, that egg that breaks down, all right, that egg that comes out during ovulation rather, has started its journey 290 days ago. That's the point I'm trying to make. Started its journey 290 days ago. I need you to appreciate this, all right? Appreciate science. So we have the primary follicle, we have the from the primordial follicle, we have the primary follicles, then we have the secondary follicles. These secondary follicles appear 140 days into the cycle. All right, everything is bigger. It forms zona pellucida, it forms theca folliculi. All right, okay. Let me see. Now we have tertiary follicles. Tertiary follicles. So it becomes tertiary follicles 60 days before what? Ovulation. 60 days before ovulation, it becomes what? Tertiary follicles. These tertiary follicles has antral follicles, has antral part of it, and also pre-antral part of it. All right. But what I'm interested in is the cumulus ophorus and the corona radiata. The corona radiata is inside the cumulus ophorus. And what is cumulus ophorus? A mound of granulosa cell on one side of the antrum that covers the oocyte and secures it to the follicular wall. It's more like the protector of the universe, protecting that oocyte. All right. So the cumulus ovorus protects the oocyte. Inside the cumulus ovorus, we see what? Inside it, surrounding inside it, we see what? The corona what? Radiator. Corona radiator. All right. This corona radiator forms the protective barrier around egg. All right. It forms the protective barrier around egg. It's just like the when we discussed the testes, we talked about the blood testis barrier, BTB. When we talked about in the brain, we talked about the BBB, blood-brain barrier. So this time around, we are talking about a corona radiator. Corona radiator serves as that barrier so that nothing will happen to this egg. All right. And remember, it's the components of what the cumulus was ovorus. They will ask you, cumulus ovorus, corona radiator, where are they found? Tertiary follicle. Very important that you know this. Now we have the mature follicles. At the end of the day, we have the mature follicles. So how many follicles have we discussed? Let's go back. We have the primordial follicle, we have the primary follicle, we have the secondary follicle, we have the the secondary follicle, that's 140 days. Then 60 days, we have the what? Tertiary follicles, which has the cumulus ovorus and corona radiator. Then last 20 days before ovulation, we have what? The mature follicles. So if you are ovulating today, all right, there's another mature follicle 20 days away. I don't know if it makes sense. 20 days away, there's another mature follicle. Okay. So let's discuss the sexual cycle, guys. Sexual cycle averages 28 days from 20 to 45 days. All right. Varies from 20 to 45 days. Some ladies have it 30, some ladies have it 35 days. I've seen somebody that has almost 40 days. All right. What regulates it? Hormones. Hormones of the hypothalamus and of the pituitary gland. The pituitary hormones regulates the ovaries. The hypothalamus hormones regulate what? The pituitary. Check it out. Then ovaries now secretes its own hormone that regulates what? The uterus. Makes sense? So this is the hierarchy. The hypothalamus regulates the pituitary. The pituitary hormones regulates the ovaries. The ovarian hormones regulates what? The uterus. And each of these can give a feedback, negative feedback mechanism to specifically the hypothalamus and the pituitary to stop what? Producing more. Does it make sense, guys? Yes. I believe it makes sense, even if you do not tell me. Thank you. No. Okay, guys. The cycle begins with 2 weeks follicular phase and 2 weeks luteal phase. You need to understand these two things. 2 weeks follicular phase, 2 weeks luteal phase. I want us to look at the diagram so that we discuss it, understand it very well. Look at this diagram, guys. Everybody. This first part, 1 to 13 days, is what? The follicular phase. 15 to 27 or 28 days is what? The luteal phase. This follicular phase is the growth of the follicle. When the follicle has matured, you understand, completely, it pours out in the 14th day. That 14th day is the ovulation. When it comes out, the mature egg is out, going to the uterus, right? Now, this is what still happens. What? This guy here, you see this guy, this follicle, becomes corpus luteum, involutes, and becomes what? Corpus albicans. You understand? Then, around this stage, this one disappears, and new primordial follicle comes. I told you, primordial follicle takes what? About 20 days. All right? New primordial follicle comes. All right? That's one that has already matured. So I need you guys to understand it. When you are talking about follicular phase, you are talking about how did the follicle grow. When you are talking about luteal phase, we talk about how does that follicle degenerate. And in the middle of it all is the ovulation phase. At that time, the mature egg, the mature ova or the oocyte has jumped out. It has jumped out to go and look for what? The sperm, to see if it will mature, if it will become what? An embryo. So it goes out to go and look for sperm. At that moment, any mistake you make, chakam. Why did I say chakam? Okay. Now, you also need to understand the hormones that controls this thing, all right? Look at follicle stimulating hormone helps it to mature. And as it's getting to ovulatory stage, the luteinizing hormone starts getting up. This luteinizing hormone surges at the ovulation. So if they ask you what surges at ovulation, it is luteinizing hormone. Then the luteinizing hormone starts dropping, and FSH starts increasing again. You see? Make sense? Simple. Straightforward. This is the female sexual cycle. Check it now. Nothing much, nothing less. Now let's talk about the ovarian cycle, guys. The ovarian cycle, which is what we just discussed. All right. Under the sexual cycle, we have the follicular phase, ovulation, and the luteal phase. All right. Now, this is the description of the entire thing. We've already discussed it. We've already discussed this. All right. Now, this is feedback that I was telling you about, the feedback mechanism I was telling you about. All right. Now, the maturing follicle secretes what? Estradiol. Remember, estradiol is secreted by this follicle. You understand that? In the ovary. The maturing follicle secretes estradiol. I told you estradiol is the most potent estrogen. Estradiol will now go back and tell the LH and FSH to start, and tell the pituitary to produce what? LH and FSH. Then some of the estradiol will go to the hypothalamus and tell the hypothalamus to secrete what? GnRH. That's gonadotropic releasing hormone. What does this GnRH do? It will tell the LH and FSH to produce, it will tell the pituitary to produce more LH and FSH. Now, this LH and FSH will come down here. Look at it. It comes down here to lead what? Ovulation. Ovulation happens. That's when we have what? The LH surge and ovulation happens. So if I take you back, let me take you backwards. This is what I'm talking about. This is how the LH surges. So what really happens is that this guy produces estradiol and sends towards the pituitary to tell it to produce what? LH and FSH. Now, it will still send more estradiol to the hypothalamus to tell it to produce what? GnRH, to encourage the pituitary to produce more LH. And immediately this LH is big enough, it will push out this mature oocyte. It will push it out. This is what we call ovulation. Okay? All right. Because when you are understanding the stages, you need to understand the hormones that encourages the stages. All right? Ovulation takes 2 to 3 minutes and it has happened. Pium, chakam, it has happened. And immediately the the oocyte start moving to go and search for its equivalent what? Sperm. Okay. So these are the signs of ovulation. These are the signs of ovulation. Sometimes there are little pains. I don't know how to pronounce this thing. Honestly, I really had, since medical school, I've never learned how to pronounce it. I think it's called what? Methyl skims. Pronounce it. Let me hear. I cannot hear you. Pronounce it. Okay, I've heard you. Somebody just said it. So that's what you said. You know that thing you pronounce now. That's the correct answer. Okay. So this is the pain. They will ask you about this pain, guys. They will definitely, that's why it's on red. Twinges of pain at time of ovulation. They tell you what is true about these methyl schemes or whatever. All right. You should be looking for this pain at time of ovulation. Best for conception. Within 24 hours after the cervical mucus changes and the basal body temperature rises. So these are the things that you are expecting during ovulation. Some people don't know when the ovulation happens. You will see some, some discharge, a little discharge, tiny and stretchy discharge. You can stretch it. So next time when you're ovulating, just do this thing, so that you understand what I'm telling you, so that you don't ever forget. Also, we have what? High body temperature. Body temperature increases, guys. Your temperature will just increase. You're not sick, but your temperature is high. Then you now start having those little pains. So you need to monitor your ovulation, especially for people that wants to give birth. All right? You need to monitor it. Then after that ovulatory phase, we have the luteal phase. These are everything that happens in the luteal phase, guys. All right? So remember LH surges. That's why we say tenfold in LH surge. Also, we have progesterone surge. Why is progesterone surging? Progesterone is surging because it is the hormone that maintains pregnancy. Remember, when you ovulate, the egg is going to look for what? Look for sperm. All right? So the progesterone is trying to prepare you in case of if you find sperm. You say what? Where does what? The discharge come from? Let me see what you said. Where does yes. So those glands up is what gives produces that discharge. If you look at it here, where did I mention it? Cervical mucus. There's something we call cervical plug. Thank you. When you are pregnant, there's mucus naturally, mucus that forms. All right, those glands form mucus that plugs that cervical. That's cervix hole, all right, so that the baby don't flush down. Do you understand? So immediately during ovulation, that mucus starts forming. That mucus start forming. What is it called? The oocyte that has been ovulated, as it's coming down, if it catches any sperm that enters inside, if it catches it and fertilizes, that mucus will no longer start going down. Instead, it will start holding itself up to form the plug. All right. So yes, you are correct. It is the glands there that forms it. Thank you for asking. Okay. And later on, if the person becomes pregnant, LH and FSH declines, all right? And it even declines, even if you are not pregnant, all right? Waiting for the next cycle. Okay. So let's discuss the menstrual cycle. The menstrual cycle. Extremely important that you know the menstrual cycle, all right? Let me see if I can see a diagram to discuss it. Yeah, okay. Look at the menstrual cycle diagram. You need to put these diagrams in your head, guys. You really need to know the ovarian cycle and the menstrual cycle. You understand? You need to know the ovarian. The Bartholin gland, it produces fluid as well. All right? It produces fluid, you know, and it's just there for lubrication. Just there, it produces fluid. But the only thing we are trying to tell you is that it is not found in the vaginal orifice. That's what we are trying to tell you. All right? I'll discuss that later. Okay, so please, I'll need you to pay attention to this particular part. All right? This is the menstrual. This is the menstrual phase or menstrual cycle. We have the menstrual phase here. This is the proliferative phase. This is the secretive phase, and this is the premenstrual phase. All right, this is the menstrual cycle under the sexual cycle. Remember, sexual cycle has ovarian cycle and also the menstrual cycle. We discussed the ovarian cycle, what happens in the ovary. Then this is the menstrual cycle, what happens in the uterus. So this is menstrual phase. This is the proliferative phase. This is the secretive phase, and this is the premenstrual phase. So the question you need to ask yourself is, what happens? Menstrual phase, look at it, there is shedding. Shedding. Everything breaks down. The wall of Jericho has fallen. This is menstrual phase. Then what happens in proliferative phase? It starts growing again. The wall of Jericho starts growing again. You see? Start growing, start growing, start growing. Secretive phase, it starts secreting a lot of things. And premenstrual phase is preparing to break down again. Check it out. This is what happens. These are the hormones that controls them. Estradiol controls this guy. Till this point. All right? Then at this point, estradiol reduces a little. Progesterone starts increasing because progesterone is waiting for you to get pregnant. And unfortunately, when you do not get pregnant, progesterone is disappointed. It just falls down again. So angry. So angry. Why didn't you get pregnant? All right? So I need you guys to understand this. So let's discuss this now in total, the menstrual cycle. Let's discuss the things that happen because it's very important. I need to pay attention on it. Now, the proliferative phase. First of all, we have the menstrual phase. All right, this menstrual phase averages 5 days in women. Averages 5 days. This one is known as vaginal discharge. All right, it keeps discharging. Some women is 3 days, some women is 4 days, some women is 5 days, some 6, some 7. All right, it's usually between 4 to 7 days anyway, plus or minus 1. Okay, that's menstrual phase. Now, this is the proliferative phase. What happens in proliferative phase? Anything proliferate is known as what? Building. What is it building? The functional layer. Remember, we have the basilar layer and the functional layer in the endometrium. 2 layers in the endometrium. The functional layer and the basilar layer. What did I tell you? The functional layer is the one that sheds. So now, menstrual phase has shedded that functional layer. All right? Now we want to build it up again. So what do? We have proliferative phase. All right? That's the rebuilding of that functional layer that has been lost. All right? So at this moment, new cohort of follicles develops, they secrete more estrogen. This estrogen is what stimulates what? Mitosis. Because new follicle is maturing. All right? It will stimulate a lot of estrogen. That estrogen is going out to say, oh, another person is coming, oh. We don't know if this person is going to meet a sperm, oh. So please, oh, I need you to build up your functional layer. So that in case of if this guy meets a sperm, pours out its egg, and its egg meets a sperm, so that it will have a bed to lie on. That functional layer is like a bed where the matured oocyte that was that met a sperm lies on. All right, that's that functional layer. All right. So if it doesn't meet an egg, a sperm, that functional layer flushes out. The bed, we throw away the bed. That's how you need to understand this thing. So this proliferative phase, start building that endometrium up 2 to 3 mm thick. Make it big. All right. The functional layer goes up like a bed. so that if that egg meets a sperm, it can rest on it. And what causes this thing? Estrogen. And where is this estrogen produced from? It is produced from what? From the follicle. Remember that. Remember that, guys. Very, very important. This is the secretory phase. Secretory phase, the endometrium thickens more in response to progesterone from couples what? Lutein. Secretory phase. At this stage, remember this is 15 to day 26, right? Meaning that at day 14, the person has already ovulated. Ovulation in the ovarian phase. Remember this ovulatory phase and this menstrual phase, menstrual cycle, the ovarian cycle and the menstrual cycle, they happen in synchronon at the same time. All right. So at day 14, the egg has already dropped, right? Now, that egg dropping happened here. Look at it here. This place. This is where it happens. So immediately the egg happens. So the proliferative phase starts happening until day 13. That day 13, in the ovarian phase, all right, the ovulation has occurred here. Look at it. It occurred here. Immediately occurred here. The menstrual phase will now be like, oh, the ovulation has occurred. So please, let's change gear from proliferative to what? To what? Secretory. That's what you need to understand. So this is the secretory phase. Extremely important that you know this thing. You need to be able to link the two of them together. All right. Now, what happens in the secretory phase? That is from day 15 to day 26. Everything becomes to thickening. All right. Accumulation of fluid. Endometrial glands secretes what? Glycogen. Everything grows. Endometrium becomes 5 to 6 mm thick. Remember in the proliferative phase, it was 2 to 3 mm thick. This time around, it is what? 5 to 6 mm thick. Becomes soft, wet, and nutritious bed. All right? Waiting for this guy that ovulated what? oocyte to catch what? To catch a sperm. All right? That's why it's forming this soft, wet, nutritious what? Bed. So that if it catches a sperm, it will be like, oh, you caught a sperm. Come and lie here. That is the secretory phase. I am trying to make you understand the difference between the menstrual phase. Remember, we discussed the menstrual phase. Then we discussed the proliferative phase. And now this is the secretory phase. Under what? The menstrual cycle. Guys, for the ovarian cycle, we discussed what? We discussed 3 phases. This guy here, we are discussing the 4 phases. 1 is the menstrual phase. 2 is the proliferative phase. 3 is the what? Secretory phase. And 4 is the what? Pre-menstrual phase. This is pre-menstrual phase. That's 2 days before the cycle. This is everything that happens 2 days before the cycle. All right. Progesterone falls because progesterone is there holding it, trying, thinking that it's going to catch what? Sperm. But because it didn't catch sperm, progesterone is angry. It falls down immediately. This is exactly what we're talking about. Progesterone falls down immediately. Chakam. Immediately progesterone falls down. This is the premenstrual phase. I need you guys to understand this thing very, very well to your fingertips. All right. So this is the menstrual cycle. All right. And this diagram here is the ovarian cycle. This is what happens in the ovary. The same time with what happens in the menstrual phases. Menstrual cycle. All right. For ovarian cycle, as a recap, this is follicular phase. You see, this part that is follicular phase, that's 1 to day 13. If you think back what I discussed in the menstrual cycle, this day 1 to 14 is what? Menstrual phase, day 1 to 5. Then from day 6 to day 13 is what? Proliferative phase. Then here, the ovulation happens. As ovulation happens here, for the ovarian phase, it becomes the luteal phase. All right? But for the menstrual cycle, it becomes what? The secretory phase. Secretory phase. Why? Because this guy that came out here, see this guy that came out here, is busy looking for a sperm. And progesterone is high here. All right? Progesterone is high. So immediately progesterone sees that, okay, this guy doesn't have any ambition to get an egg, to get a sperm, to fertilize it. Progesterone stops. And immediately you have the premenstrual phase, which leads to menstrual phase. Please, if you don't understand this thing, please tell me. I will come back to explain it again. If you don't understand it, please tell me. Yeah, it's the plot thickens. Thank you. No. You need to understand it. When a female lose their menstruation, like when they have low, see, listen, there are a lot of things that can make somebody has a menstruation, all right, lose their menstruation. There are a lot of things that can happen. When we discuss this thing, we were talking about the menarche, right? Yeah, we are talking about the menarche, the way I told you about the telac, the menarche, and the other one, right? The three of them. And I told you that if the person does not have enough body fat, the person will not even start the menstruation. Now, there are a lot of things that can make you lose menstruation. Fat is one of them. All right. So it doesn't have anything to do with the cycle. It does not have anything to do with cycle. Everything works. All right. But, you know, the hormones, I don't know how to explain this, and I'm looking for a way to make you understand. But what you need to know is that fat disrupts your hormonal arrangement. That's what you should know. Another thing that disrupts your hormonal arrangement is what? Stress. That's why when you are stressed, many times you will not see your period that year, that week, that month rather. And sometimes you will not even see ovulation at all. So there are a lot of things that disrupts it. And the third thing that disrupts it is what? Is drugs. There are some drugs you take and it will disrupt the entire thing. All right. So, but I'm not discussing pathology right now. All right. Yeah. So low fat, low body fat can cause it. That's why a lot of people that has extreme fat, like very fat people, and also people that has anorexia nervosa, their BMI less than 24. Is it no less than 18.5? You understand? They are also having menstrual inconsistency. So the two people at the extreme, people that are morbidly obese, like people that their BMI is above 40, or people that their BMI is below 18.5, they are always having menstrual problem because of hormone. So it depends on which hormone is affected. Remember, the hormone takes care of each phase. I need you to understand it. So if the hormone that's affected is the one that happens in the ovarian cycle, the ovarian ovulation will be affected. If it is the one that happens in the menstrual cycle, the menstruation will be affected. So it depends. It doesn't select. It depends. All right. So let me proceed. If you have any question, you can still throw. We answer it at the end of the class. Okay. So you see this? I have 20 minutes. Yes. You see this? This is proliferative phase. It starts growing 2 to 3. This around 5. This is secretory phase. Then menstrual phase. It starts breaking down. Wall of Jericho starts falling. All right. So endometriosis is growth of endometrial tissue outside of the uterus. A lot of women have endometriosis. Some endometrial tissue will go and grow in the abdomen. So let me tell you what endometriosis is, more or less. Remember, the menstruation happens in the endometrial layer, right? That's the innermost layer. Remember, I said the innermost layer has basilar layer and the functional layer. Endometrium is the shedding of the functional layer. Now imagine that endometrial tissue, right, grows in the abdomen. When you are having period, that particular place in your abdomen will also be having its period. That's what causes that pain. So as there's a functional layer, there'll be a functional layer in that abdomen. As there's a basilar layer, there'll be a basilar layer. So every month, that person is having pain. And it leads to infertility. Okay. So let's talk about sexual response very fast before this class ends. Sexual response, we have 1, 2, 3, 4, 5 ways women respond to sex. All right? Hold on, let me drink water. Everybody has a way they respond to sex. That's the truth. But this is the average way a woman responds to sex. This is the average way a woman responds to sex. All right? This is when she's not stimulated. Remember, for men, we discussed about men. If I have to recap for men, this is where we discussed. Did we discuss this for male? Yes. Yes, this is for males. All right? This is for males, where we discussed about the visual response, everything, how it causes excitement, orgasm stage, orgasm expulsion stage, all right, emission stage, expulsion stage, where the man ejaculates, pours out sperm, pew, and also resolution phase, all right? This resolution phase is usually around the area where a man experiences what? Refractory period. Now, for women, look at the women's own. It's a little different from the men, and I'll tell you how. First of all, this is the unstimulated uterus, all right, and vagina. So the uterus tilts forward over the urinary bladder. It tilts forward. This is the urinary bladder here. If you look at it, this is the urinary bladder. This is uterus. It tilts forward. Listen, no matter the position you are having sex, this guy tilts forward. Because one day when I was teaching something like this, somebody told me, "Oh, what if the person bends and from behind?" I said, no matter how even if you like stand, even if you like lie like this, it still tilts forward. All right. So it tilts forward over the urinary bladder, vagina relatively narrow, labia minora retracted at that moment. Normal person. This is when the woman lies normally. But remember, this is not the only position for sex. I'm not discussing position for sex anyway. Now, you need to subscribe to the channel, all right? Please subscribe to the channel, guys. And also click this hand. You see this hand like this? Click it, Aha, to show me that you are with me. Now, this is the excitement phase. I hope I'm not lagging. Please, PCOS, how does it cause infertility with a lot of people? Oh, polycystic ovarian syndrome. That one is polycystic. From the name, the ovary becomes big with fluid. That is polycystic. If the ovary becomes large with fluid, all right, it will not mature properly. And if it doesn't mature properly, it will not, even expel, it will not even push itself out. It will not become it will not undergo all these phases that we discussed. That's just what PCOS does. PCOS is just straightforward from the name. You will understand it. All right. I guess what you're asking is other things about PCOS, like hirsutism, diabetes, all those things, like increase in sugar, and all those things are just pathological symptoms of PCOS. But the major thing you need to know about PCOS is P is polycystic, PC polycystic, O is ovarian, S is syndrome. Anytime you hear syndrome means it leads to a lot of effects. All right, that's syndrome. Infertility is one of the effects. Infertility is one of what? The effects. All right. So PCOS will disrupt the entire thing. Listen, remember what we are discussing is anatomy and physiology. Anatomy is what? Location, location, location. Physiology is what? Function, function, function. The correct function, the right function. If it deviates from that function, it becomes what? Pathology. PCOS is pathology. At that moment, it has deviated. All right. Yes. So when it now deviates, it's now start causing a lot of things like hairs, all these hairs, male pattern distribution, and other things, infertility and other things. Infertility is just a symptom, actually, of PCOS. Okay. What happened? Where is everybody? We are 41 people here. Seems I'm going to take this at 10. What's the time? 3:40. Let me just keep watching. Okay. So, where did I stop? Stages of female sexual response. So this is the female when you've not started doing. Now, this is when the person starts getting excited. All right, excitation can come in form of a lot of forms. It can be foreplay. It can be just sights. Like male, just they are thinking about it. Or somebody touching them. Everything has started what? Rising. But for female, the same thing can still happen. But when a female thinks about sex, when a female sees sex happening, or when you see a female feels sexual, right? Uterus stands up. So for male, the vagina, the penis does what? Stands up erect. For female, the uterus does what? Stands up. Look at it now. I hope you are looking at the diagram. This is normal this thing. All stimulated, Uterus is lying down. Look at it. Uterus has stood up. Bakam. Like a penis. You feel me? Immediately the uterus stands up superiorly, all right? The inner end of the vagina dilates. The vagina becomes bigger. Do you understand? It becomes wider so that it will be able to accommodate that penis, all right? No matter the size. Now, the labia minora becomes vasocongested. There's a lot of blood vessel so that you will feel that penis when it enters. Blood vessel. So remember, blood vessel makes you what? Feel things. That's why the anus is very vascularized. That I was telling somebody the other day that a lot of people have anal sex because they enjoy it. That's the truth. People do, but they enjoy it. And why they enjoy it more than even vaginal sex? Because the anus is more vascularized than the vagina. So the difference is that the anus does not even need to be stimulated for it to be vascularized. It is there. Follow, come, factory fitted. A lot of blood vessels. All right. Yeah. Somebody said something. Let me see. It's a good thing we are home. Why? Because of how I'm cutting this thing. Okay, so that's the thing. But the vagina has to immediately, it sees, oh, a penis wants to come in, oh, I'm stimulated, oh, maybe there will be a penis, you start preparing for that penis to come in. Just the way the egg, the body prepares for the egg to come down into the uterus. That's the way the vagina prepares for the penis. Excitingly. That's why I call it the excitement phase. All right. Now, that vasocongestion we extend from the labial minora to outside, which is labial majora. All right. So labial majora and labial minora is now red because of blood vessel. So, during sex, just look at it properly. You see it's very, very red and swollen. That swollen is because of a lot of blood vessels entering inside, just like the penis is erected because of blood pouring inside the penis. That's how the vagina is red. We call it what? Hyperemia. All right, and becomes swollen. And also, it starts sweating. That sweating is what we call what? Transudate secretions. It starts sweating. All right, the vagina starts sweating. Now, from there, the penis has entered inside. That's chukum. Look at it. For people that don't know what the penis is, this is the penis. For people that don't know what the vagina is, this is the vagina. You see, the penis is hitting the head of the cervix. This is the window. All right. It doesn't enter inside. Somebody was asking me if the penis is very long, does it enter inside the cervix? I say it doesn't enter in cervix. You understand? Because this because this cervix will block it from entering inside. All right. So at this moment, this is the plateau phase. The uterus is tented, erected. Cervix is withdrawn from the vagina. The cervix has to shift back so that this penis will not enjoy it. So this cervix will go back, withdraw inside. All right. Now, immediately there's something we call orgasmic platform. All right. The vagina will constrict, holding the penis very well. The vagina will constrict. So no matter, somebody was, saying one time, what if the vagina is too wide? No matter how wide it is, it will constrict and hold that penis. So hold it like this. Look at my hand. Hold it like this. You go nowhere. All right. Now, at that moment, the glands is withdrawn beneath the prepuce. Labia are bright red or violet. Now, that's the plateau phase. So we've gone from the unstimulated phase to the excitement phase to the plateau phase. Then let's talk about the orgasm phase. All right. This, we call it, this orgasmic platform contracts rhythmically. You understand? It starts contracting. G. You understand? Then you see the woman, feeling it. You understand? So the cervix may dive into pool of semen. Uterus exhibits peristaltic contraction. Anal and urinary sphincters what? Constrict. Everything constricts. You understand? So one thing you need to know about orgasm is that orgasm affects everything. Orgasm, even most times, if the penis is inside, the guy will feel that orgasm because everything is at standstill at that moment in that woman's life. Everything is at standstill. You understand? The brain, everything. All right, that's orgasm phase. Then after the orgasm phase, there's something called the resolution phase, just like the male, but unlike in the male. Let me tell you the difference between the male and the female. Resolution phase, uterus returns to original position, orgasmic platform relaxes, inner end of the vagina constricts and returns to original what dimension. Everything will go back here, even if the penis is still inside. Because sometimes you may, a woman will have orgasm, the guy will keep going. He will keep going. He will keep going. Do you understand? So no matter what he does at that moment, everything is back to normal. But bear you in mind, this is not a refractory period. Female, they don't have refractory period. Women don't have refractory period. If you remember what we discussed about refractory period, what did I tell you about refractory period? I told you that refractory period is a period whereby the penis, immediately it comes, it shoots out that scum, bam, comes like this. It will fall. At that moment, anything that goes down must come down. It will fall down. No matter what you do it, no matter where you put it, it will not rise. And it takes a couple of minutes. No matter the stimulation you give it at that moment, that penis will never rise. So most times when you're having sex and the man comes, you have to wait, take some time before you start again. All right, for people that want to keep going before you start again. All right, but for women, they don't have the refractory period. That's why a woman can have orgasm 20 times in one sex, but a man will have it once. But that one is one. All right, everything is pouring. So I hope you guys understand. If you have a question, please drop a question. And if you don't have a question, I need you to click this so that I will know that you are following me. Everybody, click this thing that I think that's like. Click it so that I will know that you are following me because, okay, I'm seeing 77 people. Oh, this is impressive. This is impressive. Maybe I don't need to take attendance today. How many minutes do I have? I have 14 minutes. Okay. So this discusses everything we just discussed right now. The question they will be asking you, vagina transudates, that's what causes sweating, all right? Serous fluid that seeps through the walls of the canal. The greater vestibular gland secretion moistens the vestibule and provide what? Lubrication, all right? Aha, let me see. Perfect. You guys are doing well. Thank you. Aha, I see that you are here now. Nobody's sleeping. That's good. Yeah, so this is excitement phase, everything we've already discussed. But I didn't talk about the breast. At that moment, the breast swells and the nipple become erect. Nipple become like this, start pointing like this. All right. At that moment, sometimes some women wants you to also, help them with the nipple at that moment. So because the nipple becomes erect, it's reacting to the entire thing. It's excited. That's excitement, general excitement. So erectile clitoris is primarily focus of what? Sexual stimulation. So if you understand this chemistry very well, you'll be able to have sex properly. If you understand, if you understand this chemistry very well, you'll be able to have sex properly. Because if that woman, if you are a guy and you've already put that woman to the level of excitement, everything is excited, you can target the clitoris for that woman to have maximum excitement. You understand? At that moment, that's when you should target it. You don't target it before. Target it at that excitement and play to face. All right. And if you are the girl, you can easily, guide him to do the needful. Do you understand? Because at that moment, what that woman enjoys is not the penetration. It's not you, the penis going in and out. At that moment, what that woman enjoys is that erectile clitoris, that clitoris stimulation. So at that moment, the penis can rest and the clitoris can activate. All right. Okay. I don't want to say too much on this. I don't want to corrupt anybody here. I'm of God, please. I'm of God. So this is an orgasm. These are the things that happens during the orgasm, right? Intense sensation, all right? Pelvic throbbing. The pelvis will be quaking, all right? Everywhere will be sense of warmth. You understand? You see the woman smiling. There will be contraction, strong contraction, 0.8 seconds apart, just like as if you are giving birth, all right? Cervix plunges spasmodically into what? The vagina. The cervix will be entering the vagina. That's why at that moment you don't need the penis, because if the penis is there, it will hinder the cervix from entering the vagina. So instead, it is just the clitoral stimulation that's very necessary. All right. Okay. So so we've discussed this. There is tachycardia. You see the woman breathing hard. Tachycardia and hyperventilation. All right. And it is at that woman, at that moment, the brain is at standstill. You understand? That's why, there's some movie, there are some movies, in some movies, you will see a woman telling the guy to just hold me anywhere at that moment, right? Somebody was choking somebody and killed the person. I'm telling you the truth. This is real life story during sex. And that thing happens at that orgasmic phase. The woman was having orgasm. She wanted that guy to just hold her in the neck, and the guy held her in the neck and she died. All right. So at that moment, sometimes women experience reddish, rash-like flush on the lower abdomen, chest, neck, and face at that moment. Extremely important that you know this. And this is the resolution phase. At this moment, everything goes back to normal. But bear you in mind, I said it again and again and again. Women do not have what? Refractory period. Meaning that after immediately orgasm happens, they can continue going and going to the next orgasm, going and going to the next orgasm. They can have 20 orgasms. All right? But men is just one. Justice for the men. Okay, guys, enough. See, look at you. Look at how your ear and eyes open. Evil people here. See how your ear and eyes open. And your mouth. Every day, Nchebe is saying this kind of thing. Yes. But I'm not evil. I'm of God. Okay. Guys, so that's about it. I'm going to take the next 10 minutes to round up. All right. Every other thing is about childbirth and gestation. This is gynae. I'm not discussing gynae more. All right. But you need to also have an idea of gynae, because it may come out in your exam. Let me see. So they don't ask much question on gynae. They usually ask much question on they ask a gynae. This is obstetrics. Obstetrics is when a woman is pregnant. Gynae is when you are not pregnant. So everything we discuss is on gynae. All right. Why obstetrics? They hardly ask questions on obstetrics. Let me see. They hardly ask questions on obstetrics. Anyway, I can't see any question on obstetrics, but you just need to pay attention. So gestation period. We know what gestation period is. It lasts 266 days when a woman is pregnant. You understand? The last day of your menstrual period is called LMP, last menstrual period. All right. Predicted days a woman is pregnant is 280 days, so 40 weeks from the last MMP. You understand? Term is duration of the pregnancy. Trimester is 3 intervals of that pregnancy. That's really important that you know this. Conceptus is all products of conception. That's conceptus. All right. We have the blastocyst, we have the embryo, we have the fetus, we have the neonate from 6 weeks. So you need to know this range. Blastocyst 2 weeks, embryo 16 days. You understand? Through 8 weeks. From the 9th week, in utero becomes the fetus. 9th week. So because somebody was asking one time, what's the difference between embryo and fetus? Embryo is 16 from day 16 to 8 weeks. Day 16 to 8 weeks. Fetus is from beginning of what? 9th week to birth. All right. Then immediately you give birth, it becomes a neonate to 6 weeks. All right. So that's the sequence. You need to remember this. These are hormones that are strongest on pregnancy. We have the estrogen, we have progesterone, we have the HCG. This HCG is very, very important. This HCG holds the pregnancy until progesterone is big enough. And this HCG is what you see initially, right? So when a woman is pregnant, we see the HCG in the urine, and that's why we're checking for pregnancy. Very, very important that you know this. All right. Yeah, so this corpus luteum, we already discussed what it does. Then the placenta also helps. When corpus luteum degenerates, placenta takes over its endocrine function. Placenta starts producing hormone when the corpus luteum what degenerates. Very important that you know this. So this HCG, I mentioned it initially. That's what we detect in urine for pregnancy. They will ask you a question about HCG. Please remember. And what secretes HCG? Blastocyst and what? Placenta. Extremely important that you know this. Here is everybody, guys. Where is everybody? Where are they? Please don't make me do this thing. Please, tell them to come back. We just have 7 minutes. So this is estrogen, people. I should be seeing like, so if you have group chat, tell them to come back. So this is progesterone secreted by placenta and corpus luteum. All right. Suppresses uterine contraction, prevents premature childbirth and menstruation. So why you don't contract when you are pregnant is because of progesterone. Remember that. That's why you are not contracting when you're pregnant. Once the progesterone decreases, you start contracting, and that is when you have to give birth. If the progesterone, did not function properly, you have premature birth because of contraction. And this progesterone is secreted by what? Placenta and what? Corpus luteum. They suppress FSH and LH, preventing follicular development. That's why you don't you don't get pregnant when you are pregnant. You don't get pregnant again because of FSH and LH. You don't even see your period because of FSH and LH. All right. Okay. So these are the functions of progesterone. You need to know the function of progesterone. Remember, secreted by placenta and corpus luteum. Remember, suppresses uterine contraction. Remember, prevents what? Premature childbirth and menstruation. These are the major things they will ask you for progesterone. Then this is HCG. This HCG is what holds pregnancy. All right. That's what we see in the urine. I mentioned it initially. It seems to reduce the woman's insulin sensitivity and glucose usage, leaving more for the fetus. You understand? The HCG gives the child more sugar instead of the mother. All right. So these are other hormones of pregnancy that I need you to go and look at it, like ACTH, like aldosterone, what it does, it rises. So everything rises in the mother. So the women are very, very important. These are the major hormones. This HCG. Immediately HCG start falling, progesterone is now rising, estradiol is now rising to support the pregnancy. Extremely important. Okay. Extremely important. All right. Let me see what else you need to know. So this is adjustments to pregnancy. The digestive system changes, the metabolism changes, it gets higher, nutrition changes, it gets higher. All right. Then sometimes vitamin K given in late pregnancy to newborns to promote prothrombosynthesis minimizes risk of neonatal hemorrhage. Okay. Vitamin D supplements also. Folic acid should be given before the woman is even pregnant to avoid what? Spinal bifida. Extremely important. So remember vitamin K, folic acid, and vitamin D. All right. So circulatory adjustment has to happen. Everything has to change in the mother's body because it's adjusting towards pregnancy. This is the respiratory adjustments. Go and look up the respiratory adjustments. All right. Everything increases. Everything increases. You understand? Because now she's doing job for 2 people. This is the urinary adjustments, which I need you guys to also look at your leisure. This is the skin adjustment. The skin also adjusts. Yes. There's expansion of the abdomen. Your tummy get big. You understand? You start having stria and other things. Very, very important that you guys understand this. All right. Then before you know it, expulsion, childbirth, maturation. That's the process of giving birth. All right. This is contraction. What leads to contraction? All right. Oxytocin is produced. Remember, oxytocin is produced from the by the hypothalamus and stores in the posterior pituitary. They will ask you a question. Posterior pituitary does not produce oxytocin. It doesn't produce it. Bear that in mind. All right. What else do you need to know? You guys are hitting 102. That means we are not going to take attendance now. That means everybody's here. Because you are hitting 102. This is labor contraction. I have 3 minutes, all right? This is labor contraction. So I need you to go read up labor. But bear in mind that what you need to read up more is from page 1 to page 100, all right? And we are going to, this is stages of labor, dilatation, expulsion, and placental stage, all right? Every other thing is talking about labor. Let me see, crowning, expulsion. This is okay. Then this is after labor. This is lactation. You need to, please, I need you to go read up lactation, all right? I'll give you some review question on it. Read up lactation. Because I see one question on lactation here. See one question on lactation, but I won't have time to discuss it. Okay. So I think I will, this is a contraceptive. Please, try to read up contraceptive as well. It's part of your physiology. Try to read it up for avoiding of pregnancy. You understand? We use contraceptives. Try to look at it. Different types of contraceptive. These are the different types of stopping pregnancy. These are the different contraceptive. This is such. A woman come to the hospital one time with the husband, and the husband was like, and that we can actually tie up. The husband was teaching us. He said we can actually tie up the cervix. No, is it no? He said we should tie up the tubes. You understand? We actually do it for contraceptive. Now the wife was now like, why don't you tie the doctor's difference? You understand? So that you don't produce sperm, which makes sense because the two of them are methods of what contraceptives. All right, but everyone is defending he or herself. I told them go home and discuss what you want. When they come back, both of them they had like 7 children already, so they are trying to stop giving birth. So I don't know why they are saving the sperm and the egg. You know. Anyway, that's by the way. So, do you have any question for me? I'm not taking attendance. You guys are complete. So, do you have any question for me? We will do revision for reproduction, male and female. If you need review for endocrinology, please go and look up what we did yesterday. All right, go and look it up. Review for reproduction is on Tuesday. On Tuesday. Yes, Tuesday. All right. It's on Tuesday. If you have any question, you can drop right now. If not, I'll leave you to go back to your team. Thank you so much for being there. I'm proud of you guys for making sure that everybody's here. And I'm so sorry for not coming in person today. Just because of my leg is disturbing me. What time tomorrow? That's what I don't want to promise you, but it will be between 8 and 9. No. It will be, tomorrow is what? Tomorrow is Tuesday. It will be between 7 to 9. One of those times. Between 7 to 9. What time do you guys want me to do the review? Everybody, just put the best time for you tomorrow. Just drop the best time, then I will pick the one that is highest. Everybody, before you go, drop the best time for you. You want me to do the review. Thank you. Yes, I'll get better. Thank you. Oh, you can finally type. Congratulations. The truth about that, for you to type, you need to be logged in with your own this thing onto YouTube. 7. Hey. 7 o'clock tomorrow. Will I be back 7 o'clock? I can try. You're welcome. Thank you so much. Thank you. 7 o'clock. Okay. 7 o'clock. Then we end by 10. 3 hours. But please. I know. No, don't worry. Everybody was here. You guys were almost 100. Like a lot of people, even from here and external, even some people from Nigeria were here. And don't worry. That's why I said no need, so that we don't waste our time taking attendance. So please, tomorrow I'll consider the 7 o'clock. And if it will happen before, please, I need you immediately. I send the message, put it in your groups. All right, your different friend group. Tell your friends, because if I come here, I need to have not less than 40 people. Please, please, not less than 40 people. If not, if I come here and it's less than 40 people at any time, I'll just stop. You understand? I'll just stop because I bring out my time, so you should bring out your time. You understand? So please, just be logged in. Even if you're at work, be logged in. Somebody said I have bio until 9. Oh, lab. Lab. Yeah, I have lab until 9. Okay, you see, somebody said I have lab until 9. So what will happen is some people are saying 7, some people are saying they have lab until 9. That means they want me to start probably around 9. So what will happen is it's supposed to be a 3 hours review. So you can actually join late, no problem. It's fine that you join late, but at least 40 people has to be online at every time. All right, at least 40 people for me to be able to maintain that vibe. 9, 7. 9 plus 7 divided by 2 is 8. So maybe I should start 8. So that people that want 7, 1 hour sacrifice. People that want 9, 1 hour sacrifice backward. Oh, about 25 people have by 9. Okay, if that's the case, then let's start by 9, please. Let's start by 9. So that even if you are not home, if you are driving home, you can just drive. And also you can tell your lab professor that they can finish up early. All right, they can actually finish up early because most of my lab I finish in less than 2 hours. So they can finish early and you leave by 8. So if that's the case, let's do 9 o'clock tomorrow. 9 o'clock. Hi. 9 o'clock, 9 o'clock, 9 o'clock, 9 o'clock. Okay, 9 o'clock tomorrow. Guys, 9 o'clock tomorrow. Please, 9 o'clock tomorrow. Even if you are feeling sleepy, get cold water, put your leg on it, and be awake. You need it. Trust me, you need it. You understand? You need it. All right. Tell your friends, even people that are not in the class, because this will also be the final exam preparation. It's part of the final exam review. I may still do final exam for you because I want to review some of these documents. But this is also part of the final exam review. Because all the questions I'm going to discuss with you is in the final exam. So tell your friends that are not in the class. Can't you guys go back to the live? Don't know what she's saying. So thank you guys so much. I appreciate you guys. I will see you tomorrow. I'll see you tomorrow. Yeah, you're welcome. Thank you so much. Thank you so much. I'll see you. Have a nice one, all right? I'm trying to catch someone. I need to inform the lab person that I won't be coming for lab today. Okay, so see you guys later. Yes, thank you so much. Have a nice one, all right? No, I'm not having lab today, but I need to send a message to the lab this thing. The lab will be online. I'll send a message out for the lab. I really can't walk, so, having so much pain right now. All right, see you guys later. Take care. Take care, guys.